For my disease, I chose to do Krabbe disease, which is also referred to as globoid cell leukodystrophy, GLD, and causes a deficiency in galactocerebrosidase, GALC, the enzyme responsible for preventing the buildup of glycolipids in the brain. Krabbe disease is also an autosomal recessive neurodegenerative disorder. It is one of the subgroups of metabolic disorders called the leukodystrophies, which is when the myelin is damaged due to genetic mutation. When the myelin sheath is damaged, the signals slow down or may stop completely. A person gets the disorder when he or she inherits the gene mutation from both parents. And this right here shows that both parents, which are unaffected carriers, when they have children, 1 in 4 children have a chance of being affected with the Krabbe disease. The metabolic process of Krabbe's can be complicated as the axon nerves and the myelin is deformed and broken down over time. The problem in this breakdown is what causes the symptoms of leukodystrophy and when it affects the nervous system. The oligodendrocytes are the synthesizing cells of lipid-containing globoid cells. And this right here shows a picture of a person with Krabbe disease. Their globoid cells are abnormally large. Symptoms of the disease for the early onset of Krabbe's can include vision loss, hearing loss that leads to deafness, severe vomiting, unexplained fevers, and individuals with late onset form of Krabbe disease can be clinically normal until almost any age when symptoms of weakness, vision loss, and intellectual regression become evident, and symptoms can vary from patient to patient. GLD can be measured by testing a sample of blood or skin cells to measure the activity level of the enzymes GALC. Patients with GLD show very low GALC activity level. And this is a diagram of the testing that is done when the GLAC activity is tested. If there is less than 20% of the daily mean, then it goes on to further testing in duplicate. If there is greater than 20% of the daily mean, then the screen is negative. When retested in duplicate, an average of 3 samples that is less than or equal to 8%, the screen is positive, but they also do further DNA testing. If the average of 3 samples is greater than 12%, then the screen is negative. Averages of 3 samples that are between the 8% and 12%, they do further DNA testing. Once the DNA testing is done, if there is no mutations, then the screen is negative. But if there is 1 or more mutations, then the screen is positive and they go on to further referral for more treatment. To confirm the diagnosis of Krabbe disease, the doctor might recommend 1 or more of the following tests, which is imaging scans of the brain and the head, eye examination, genetic testing, and nerve conduction studies. Before birth, a fetus can be screened for Krabbe disease. The cells in the amniotic fluid are withdrawn from the fetus and examined. The treatment of Krabbe disease depends on the type of disease that the person has, whether it's early or late onset, and the only known treatment that has had any effect on the progression of the disease is the bone marrow or cord blood transplant. With the cord blood transfusion, stem cells are taken from the umbilical cords of any related donor, and they can result in the reduction of the neurological symptoms in the infants. If it is done before the symptoms are appeared, it's possible that the child can maintain his or her vision and hearing abilities. With the late onset form of Krabbe disease, that people have benefited from treatment with the umbilical cord, blood stem cells, and although this treatment has been most successful in pre-symptomatic patients, neural deterioration is slowed and symptoms can be less severe. Gene therapy has been a new attempt to provide working copies of genes to people with the non-working copies. This picture right here, A, B, and C are just different angles of an infant with Krabbe disease and the enlargement of the optic nerve that can appear. This picture right here shows the posterior, an image of the posterior fossa of the abnormal hyperintense foci in the region of the dentate nuclei with some surrounding hypointensity right in that area. Down here, A, B, and C are pictures of a 7-month-old infant with Krabbe disease, and D, E, and F are a picture of another 7-month-old infant without Krabbe disease, and just showing the difference in the cerebrospinal fluid and the myelinated matter, and that there is some volume loss of the brain and normal myelination does not occur. There are also typical abnormalities in the cerebellum and thalami. Early detection is the key to fight Krabbe disease, and the only way to prevent it is if parenting testing is done when people decide to have or are considering to have children.